of ultrasound. So hopefully that is clear. The PowerPoint is divided into 2 PowerPoints. I'm going to divide the lecture up into smaller chunks just to hopefully make it so it's not overwhelming. So throughout the whole 2 PowerPoints, we're going to talk about the introduction, of course, terminology, and the usual things we introduce, the effects of ultrasound, thermal and non-thermal, the clinical indications, contraindications, precautions, and adverse effects, like we always do, the application technique, and then, of course, how you document ultrasound. So the learning objectives for this first half of the PowerPoint, I want you to be able to discuss how ultrasound is generated, and we will talk about that in just a couple minutes. I want you to be familiar with the terminology listed in the Chapter 9 glossary. In the 5th edition, it's on pages 192 through 196. If you are using the 4th edition of the book, I don't know the exact page numbers, but it is at the very end of the ultrasound chapter. And there's a lot of terminology with the ultrasound that is specific and unique to ultrasound. So it's a good idea to flip to the back of the chapter and familiarize yourself with that first before you read the rest of the chapter, because they start right away on the first page flinging in that terminology. So I want you to know what the relationship between frequency and depth of penetration is. I want you to know the relationship between absorption, reflection, refraction, and attenuation. All that terminology right there in that objective. And the relationship between duty cycle and CUS, which is an abbreviation for continuous ultrasound, and PUS, which is an abbreviation for pulsed ultrasound. I want you to be able to describe how frequency, intensity, and duty cycle work together to create a treatment directed to a specific tissue area. So in kinesiology last spring, we talked a lot about one muscle is superficial to another muscle or deep to another muscle, and I believe that I said it's difficult to treat a tissue if you don't know where it's located in the body. So that's why we studied that in kinesiology, where things are. So now we have some treatments and we want to direct a treatment to a specific tissue area, and we have the knowledge to do that. So there's a little blurb at the beginning of the chapter on the history of ultrasound. It's pretty interesting. It's been around since the end of the 19th century, but its first major use was in World War II, where submarines used sonar for underwater tracking, either looking for obstacles underwater that might be in their way, or finding other submarines. That's the thing. And so it wasn't until after World War II that they started developing therapeutic uses for ultrasound. So I think probably one of the therapeutic uses that everybody in the public is familiar with is the imaging that's used for ultrasound. But what we use it frequently for in the clinic in PT is for thermal or healing effects, the non-thermal effects. So ultrasound most effectively heats deep tissue with high collagen content, such as tendons, ligaments, and joint capsules and fascia. You can see how that would be a useful thing, to have that deep heating treatment that specifically targets those collagen tissues, which are so often the injuries that we're treating in PT. So it was initially used for its thermal effects, and then subsequently it was found to have non-thermal effects as well. And a lot of the therapeutic applications have been developed over the last 20 years for using these non-thermal effects. So it's the non-thermal form of ultrasound is the low-intensity pulsed ultrasound, and then the continuous ultrasound is the thermal form of it, and we'll talk about that a little bit. In the module, I have some links to videos about how sonar is being used for tracking whales, and then also the effects of sonar on underwater life. So the effects of sonar on underwater life were noticed during World War II, and there's been a lot of study done on that. So that material isn't required. You're not going to be tested on it or anything, but I just think it's kind of interesting. And if you have time and you're interested in it, then go ahead and watch those videos, or bookmark them and watch them later if you're interested in them. The third one that's in the module is on therapeutic ultrasound. It's a good general overview. even though in my opinion he moves the transducer head too fast. We'll talk about, when we talk about the application technique, the speed at which you're supposed to move the transducer head, and you'll get to practice that in lab. But other than that, this is a good video, and that one I recommend that you watch. There are also the modality application videos from the publisher of the textbook that you have access to, and they have ultrasound videos in there as well. And those ones are nice and short. So this is your standard ultrasound machine that you'll see in the clinic. The major manufacturers are like Chattanooga and Mettler, electronics manufacturers. They're usually different size transducer heads for different size body parts, and we'll talk about all the different settings and treatment. For those of you that have worked as aides in clinic, you are probably very familiar with these. So ultrasound, it is a type of sound, just like audible sound. It consists of waves that transmit energy through the air by alternately compressing and rarefying the material in the air. So ultrasound is usually sound outside of the ranges of normal human hearing. So normal human hearing tends to be in the 16 to 20,000 hertz range. A hertz is a cycle per second, and that's the frequency. And so ultrasound is outside of that range of normal human hearing. Most therapeutic ultrasound has a frequency of between 0.7 to 3.3 megahertz, otherwise known as 700,000 and 3,300,000 hertz. So way over normal human hearing. And the energy absorption through the body at those frequencies tends to be in a depth of from 2 to 5 centimeters of soft tissue. So around 1 inch to 2 inches. So the ultrasound has thermal effects, or heating effects, and then it also has non-thermal cellular effects. As the ultrasound wave travels through material, it attenuates. Just like audible sound, as you get farther away from it, it attenuates, it gets smaller or lower, and you can't hear it as well. The same thing happens with ultrasound. And so as ultrasound moves through human tissues, it decreases in intensity as part of it is absorbed by the tissue. So ultrasound has a variety of physical effects that we'll talk about, and they're usually classified as thermal versus non-thermal. So increasing tissue temperature is a thermal effect. There are some cellular or microscopic effects, and in the book we'll talk about this individual terminology when we're talking about the physics of ultrasound. Acoustic streaming, microstreaming, and cavitation. And basically the ultrasound tends to move the material it passes through in a circular motion, and that might have an effect on cell membrane permeability. So that's the healing or non-thermal cellular effect of ultrasound. So it's kind of interesting that we started out with an application which was pretty superficial, and then we end up with something that has cellular effects. So pretty interesting. It's that compression rarefaction wave, and it's sound with frequency greater than 20,000 hertz. And the therapeutic levels we are talking about are way up there in the 700,000 to 3 million range. So the sound wave is generated by applying alternating current, electrical current, to the crystal that's in the transducer of the ultrasound head. So the crystal is made of a material that is said to have piezoelectric properties, meaning the electricity causes it to expand and contract as the alternating current vibrates. Okay, so there are some naturally occurring materials with piezoelectric properties, such as bone, and naturally occurring quartz crystals. But normally in the ultrasound that we use in the clinic, the crystal is made of a synthetic material that's called plumbium zirconium titanate, or PZT. And we use that because it's a lot cheaper than using quartz crystals. And it's man-made, so it's readily available. So the alternating current causes the crystal to expand and contract at the frequency of the current. The expansion compresses the material in front of it, and the contraction rarefies or decompresses the material in front of the crystal, and that's what generates the ultrasound wave. So the sound wave, or the vibration energy, is transmitted to the tissues when we apply it to tissues, and it causes compression and decompression of the molecules. So basically it vibrates the tissues, and that's what therapeutic ultrasound does. So most of the units that we have in the clinic are multi-frequency transducers that use a single crystal which vibrates according to the frequency that's applied to it. And so the manufacturer gets the right crystal and installs it in the machine and gives us control so we can choose which frequency we're going to vibrate at. So that's all I'm going to say about that. So the sound wave that is created by the expanding and contracting crystal is what produces the wave. The piezoelectric crystal itself is also known as the transducer head. So it's the part of the ultrasound unit that contains the crystal. That's why you don't want to drop the ultrasound, because you can damage the crystal. So I'm going to wrap this up right here, and then in the next section we're going to start talking about terminology.